and welcome back to the Career Catalyst, the podcast where we explore life behind the titles and dive into the stories, insights, and experiences of professionals shaping the world of medicine and healthcare. I'm your host, Maya, and in today's episode, we are exploring the world of physiotherapy, rehabilitation science, and patient-centered care. Joining us today is Dr. Lissa Pacheco-Brousseau, a registered physiotherapist and assistant professor in the physiotherapy program at the School of Rehabilitation Sciences at the University of Ottawa. Dr. Pacheco-Brousseau completed her PhD in Rehabilitation Sciences at the University of Ottawa, and her work focuses on improving how rehabilitation care is delivered. Her research explores topics such as chronic disease management, musculoskeletal health, shared decision-making with patients, and the implementation of evidence-based care in clinical practice and health systems. Through her work, she aims to make rehabilitation care more patient-centered, effective, and aligned with the needs and experiences of people receiving it. Today, we will be discussing her journey into physiotherapy and research, the importance of patient engagement in healthcare decisions, and how implementation science helps translate research into real-world practice. Thank you so much for being here, Doctor. It's a pleasure to have you on the podcast.
Thank you very much. What an introduction.
Thank you. So to start off, could you please tell us a little bit about yourself and the work that you do?
Yes, of course. So you kind of already gave the blurb of what I do, but I'm an assistant professor here at the University of Ottawa. I'm also a trained physiotherapist, but my work focuses on being a professor. So I teach students in the physiotherapy master's program here at U Ottawa, and I also do research. So there's kind of two components to what I do. In terms of research, like you said, it's really focused on a bigger concept of appropriateness. So the right care for the right people at the right time, delivered by the right healthcare professionals and in the right settings. And you already mentioned, I look at shared decision-making, also, which is how to engage patient in decisions, using evidence-based practice, and how we can all translate that into practice.
Wonderful. And what first inspired you to pursue a career in physiotherapy and rehabilitation? And was there a specific experience or moment that led you towards that path?
Oh, for sure. So I was into sport when I was little, and then I found tennis. I started a competitive tennis career. So I played provincially, nationally, and also internationally. I got a scholarship to go to the States to play for a Division I school. So throughout my tennis career, I did spend a lot of time with physiotherapists. They really helped me, not just to get to my goals, but also mentally. And I really, that's when I found a second passion of mine, because the first one was tennis. Mm-hmm. And then that's when I think I was maybe around 15, and I had a clear goal in mind of becoming a physiotherapist.
Wow, 15 is very young.
You
had
right?
a clear vision very early.
Yes, but then things evolve a bit. So I think there's a question about that. So
yeah, we're going to get into that.
Exactly.
Could you walk us through your academic and professional journey, and what were some of the key turning points that shaped your career?
So I started my, my professional academic career is just beginning. I'm in this position. I started this position in July 2025, so it's really at the beginning of my career. Mm-hmm. However, I've been in academia for a long time now, because you need to do a bachelor, a master's, and then a PhD to have a professor position. So I started my academic career in the States, like I said, playing tennis. And then I realized that I knew I wanted to become a physio, so I had to come back at one point here to finish my degree here, and then I entered in physiotherapy. So really a key turning point was, because still at that point when I was starting my master's, I had one goal, was to become a physio. Then when I started my first, we call it placement, so a clinical internship kind of, that's when at the same time I also started to do a research project that we have to do when you're doing that physiotherapy master. So they kind of happen at the same time. And that's when I realized that I do love physio. I love the profession. I love what it stands for. However, I never, I only had research courses. I never done research before. So doing hands-on research kind of opened a new door for me and a new window to a passion that I didn't know existed. So I was like, maybe doing a PhD at one point in my life will be fun because I could see how I could have a bigger reach to help patients with, improving what we know about healthcare and physiotherapy. And at that time, the prof that was my or the lead on that research project I was doing in my physio master's had an opening for a PhD position after I finished my master's. So everything kind of just aligned, and I decided to take that opportunity and just do my PhD now instead of waiting a couple of years.
That's cool. Yeah. And in pursuing research and for students interested in that, what would you advise them?
So if you're interested in doing research, profs always, at the university, they always have ongoing research projects. And they are always looking for help in doing that research. So it's just emailing the professor with your CV and a blurb of why you're interested. And look at their website or their web page to kind of see if your interests are matching theirs. And then just ask for a meeting if you can maybe just discuss and see if there's possibilities to help them in some projects. So you start like that. And then if you see you like it, there's always opportunities to do master thesis and then PhD if you really like it.
That's nice. Thank you very much. And for all students listening, put yourself out there. Yes. Email your professors.
Yes.
So what are some experiences or realizations that have influenced the way you approach your work today, whether as a clinician, researcher, or educator?
So the first big realization is that I've learned or realized that it's really important to learn from individuals' lived experience and also to embrace it. Healthcare is very deeply personal. There is no treatment that is a one-size-fits-all. We all have our personal values and things that we believe are most important to us. And at the same time, a condition is you can read about it, but living it is really different. So it's really important to consider those lived experience in healthcare and research as well. The second thing that I realized is that there's gaps in research. So I realized that research is evolving. So the known truths that we have today might not be the same in a couple of years or decades. And we always need to keep that in mind when we're discussing or talking about healthcare or research, is that it's always evolving. And the other thing, I think the biggest thing is the more I start to learn, the more I realize I know nothing or know little. There's so much things to know, and even if you spend your career like learning about something, there's always more thing that you don't know, and that's why we do research. So yeah.
To comment on what you said when you mentioned that like research is always evolving. That's right. It like every single day something new is discovered, and there's new research publications on it, and it's good to be up to date with all new science information and things like that. And also speaking about the knowledge that we have, that is so right. I think we, like, as human beings, we don't have that much knowledge, even though we think that we know everything, but there's still a lot more to explore, and there's still a lot more to discover in the future.
For sure.
Yeah, which is why we have to keep up to date with all the research.
And be curious.
Yeah.
And it's okay to think something one day, and then a couple of years later, your perspective shifted.
Yeah, that's right.
And the known truths that you had are not the same anymore.
Yeah.
It's okay.
Things keep evolving.
Exactly.
So, yeah.
Exactly.
It's important to stay open to that.
Yeah, for sure.
So, and one of your research interests is shared decision making and patient centered care. For listeners who may not be familiar with this concept, what does shared decision making look like in practice, and why is it important for patients to be actively involved in their healthcare decisions?
Good question. So, shared decision making means involving patients in their healthcare decision. So, if I can make a simple definition, it's a collaborative process where decisions are made together by healthcare professionals and patients, either with or without their family. And that shared decision, it's based on the best available evidence that we have, and also the informed values and preferences of patients, considering all the available treatment options and also the pros and cons of these options. So overall, that's shared decision making.
And I think it's also very important for the patients to be, aware of all their options and things. It also helps with their anxiety, right?
Yeah, exactly. And other things that why it's important, it's the ethical thing to do.
Yeah,
so
that's
in
right.
healthcare, you're supposed nowadays, you're supposed to do patient-centered care, like you mentioned at the beginning. Every decision should be based on patients' preferences and values.
That's right.
And also, it does provide or respect the autonomy of patients. Also, research has shown that it's only beneficial. We haven't shown or demonstrated any harms of doing shared decision making or patient-centered care. There's benefits to the patient, to healthcare professionals, and also to the healthcare system. And also, when you think about it, healthcare, the core of healthcare are patients.
Yeah.
So we make decisions with patients or for their health. So they are really at the center of every decision. So they should be partnered for healthcare professionals in every decisions.
And I just had a question on that. So what happens when you and the patient are not on the same page?
Well, it's okay.
Yeah.
It's totally fair. A healthcare professional shouldn't be making a decision for a patient. So when you're a healthcare professional, you're here to provide information because you're the expert on the condition, the theory behind the condition, and also you have your expertise. You've seen other patients. But the patient, his expertise lies on living with the condition.
Yeah.
Like I said at the beginning or previously, there is no one-size-fits-all treatment. So what you think might be the best for that patient is maybe not true for his lived life. So when you're a healthcare professional, you should try to be neutral. Yes, you can provide recommendation, but at the end, there should be a shared agreement on okay, that's what you think is right for you. It's not going to harm you. You're still the healthcare professional. You need to provide the available treatment options. So that's where your role comes into play. But it's the patient. It's his life. It's his care.
Yeah.
So he has the lead on it.
Yeah, which is valid. So basically, you provide them, you present them with the options, and it's their choice eventually.
Exactly. And of course, it's a shared decision. So there's a deliberation, information exchange. You want to understand where they're coming from.
Makes sense.
And you're only providing available options. You're not providing options that are not on the table.
Yeah.
If the patient, I do a lot of work on osteoarthritis. And there is kind of a wide range of treatment for that. When you're at the early stage of osteoarthritis, it's more, we call it conservative treatment. So exercise, weight loss, medicine. But when you're more at the middle or end stage, you can start considering surgery. But when you're at the early stage, an available option does not include surgery because you're not there yet. So that's where your healthcare expertise comes into play.
Makes sense. Okay. So your work involves implementation science and knowledge translation, which focuses on how research findings are applied in real clinical settings. What's the importance of it, and what challenges exist when trying to translate research evidence into everyday healthcare practice?
So it has been shown that even if you produce the best quality research, this is not enough on its own to really make a difference in practice. So there is really a big gap between research and clinical practice, and knowledge translation and implementation science are a bridge between that gap, because it has been shown that it takes around 17 years for something that we discover, usually on average, to be really implemented or in a continuous fashion in practice. So when there's a lot of researchers following implementation science to help bridge that gap and make sure that what we discover is used in practice more quickly. So how we do that, or why we do that, you need to remember that research is done usually in a controlled environment. Healthcare is a really complex environment. Also, it's really difficult to change behaviors. So when we do research, there's kind of steps or frameworks to keep that in mind and make sure that we consider all of those things to make sure that what we discover will be implemented in practice and used by healthcare professionals.
Makes sense. Okay, so you've mentioned that collaboration with individuals who have lived in experience of health conditions is an important part of your research. So how does including patients' perspective influence the way healthcare research is designed and conducted?
Well, overall, it just makes research better.
Yeah.
Because, again, we are the experts in research and healthcare. We are not the experts in their lived experience. So by including patients in research teams as research partners, not as a participant, really as a partner, it helps you identify the right questions, also the right methods that you might not have thought about for your conducting your research. Also looking at the data and how to present it to a wide variety of audience. They help shape that as well. And also for dissemination and communication, they're really great partners for that.
And looking back at your work so far, what has been the most rewarding part of your career?
Teaching. I really do enjoy teaching. Yeah. I like teaching students the latest evidence. It's really it's a good feeling when you're teaching something that you discovered or helped shape.
Yeah.
Also helping shape the next generation of physiotherapists is also something that I feel that is really rewarding. And the other thing would be creating a space for patients to speak and be heard. I think that's something else that is that I found really rewarding in my career.
Yeah, I agree with you on that one. Yeah, because I hear a lot of stories about this specific topic, with people feeling not like they're not heard, and you know they don't have their own, just like you said earlier, like their autonomy and stuff, and they want to have their their voice. So it's very nice to hear that, it's also something that, you care about, and hopefully also a lot of people care about it too,
Yes.
Yeah.
And we need to consider or think about all of this in the context that we're living in.
Yeah.
Healthcare or her healthcare system is really complex.
That's right.
Healthcare professionals are put under a lot of pressure.
Yeah.
Time constraints. There's not a lot of resources. There are evidence being published every single day. So it's not easy to take the time to do all of this.
That's right.
Changing behaviors also is not easy. But if little by little we kind of put it as the norm of listening to patients and for them to be really heard, it's going to become more easy at the end of the day.
Yeah. So if you could go back to the beginning of your career journey, what advice would you give your younger self, and what would you change or approach differently?
So I have probably 3 big advice. The first one would be to enjoy the ride and be present. Looking back at it, I was really driven, motivated, as a lot of students are. I was always looking at the next step. So finishing my bachelor, getting into physio, finishing physio. then starting a PhD, finishing a PhD. And it's so you're always kind of chasing the next thing, and then you stop, and then you realize that it's been 10 years and you had a lot of fun, but you might not, like, just take the time, be present, and enjoy the ride as it goes. The next thing would be to take every opportunity that you have. The unexpected opportunities are the ones that shaped the way or the path I end up being on. And finally, be open that your plans might change. Like I said, at 15, I thought I was going to be a physio. I am a physio, but I am not a clinical or clinician. You know, I thought I was going to be working with athletes and being on the field. And then I found a passion for research, and it's shaped, like, I'm a physio. I do research for physio, and I teach physiotherapists, but I do not work clinically like I first thought I would. So just be open to change.
Yeah. And like you said, I also think it's very, very important to celebrate yourself throughout the journey, and don't just, like, you know, keep looking at the next step, you know, and keep, like, raising the bar whenever you accomplish something, like it's a checklist to go through. Yeah. And I feel like a lot of students fall in that trap, including myself.
And I think it's great to say that you need to celebrate all the little milestones.
Yes.
Are really important.
And it also keeps you going. So
exactly.
Yeah.
And you're more present.
That's right. Yes. It helps you be more present and, you know, keep going. And the other thing also, not being discouraged when something changes in your path, because, you know, it probably happens for a reason.
Yeah.
And I feel like also a lot of students, and a lot of people in general, not just students, they get discouraged when something doesn't go as planned or as they hoped or as they imagined. But then eventually it turns out to be something that was meant for them.
Yeah, so. Exactly. When I finished my PhD, there was no position open as a professor in universities. I took a path of going to the federal government to work for Health Canada for a couple of years with a role in implementation science, so still related to something I've done. And it really helped me be where I am today as a prof. Also changed my perspective on things. And now I think I have an even clearer mind being in this position than what I had when I finished my PhD. So, you know, just enjoy the ride, learn from every experience, and you'll just grow from it.
There was one question that just came to mind before asking this last one. So when looking on researching different conditions and, you know, like rehabilitation and how it applies to those specific conditions, like you mentioned, your focus is on osteoarthritis. How is it different for each condition? Like, what factors do you keep in mind when researching them, if that makes sense?
Oh, that's a loaded question.
Yeah.
So my work did focus on osteoarthritis, like most of it, because when you're doing a PhD, it's important to know that you need to have really a focus topic. And then when you start if you become a professor that does research, your topic does broaden a bit. So that's why I do rehabilitation. I do a lot of more MSK or musculoskeletal condition, but you cannot do everything at the same time. So it's really difficult to answer because you need to take into consideration a lot of things, and you need to research what drives you as well. You know, we need to have fun in our jobs as well.
Yeah.
So for me, patient-centered care is important. Patient voice is important. I did study a lot or research a lot on osteoarthritis during my PhD, more around the surgery side, having or not a surgery. And now I'm like, I realized the last couple of months that maybe I want to take a step back and more look at their journey and all of the decisions that they go through and how we can help them throughout those decisions. So your research path will bring you to different topics or of interest with with your previous research findings, but also with all of the collaborations that you do with people that you talk, with patient partners that you talk, and it will shape what you do.
Yeah, so basically just have, multiple resources, like you're
Yes.
saying, and take into consideration everything, including the patient and
Yeah,
their life.
Of
right?
course.
Yeah.
For sure. Yeah.
Before we wrap up, could you leave our listeners with one thought or message to carry forward? What would it be?
So when the time comes for you to face a healthcare decision, because it will, remember that you do have the right to be engaged, to ask questions, and to speak your truth. So I suggest that you remember those 3 simple questions that will help you get involved in research. So ask your healthcare professional, what are my options? Ask your healthcare professional, what are the possible benefits and harms of all of those options, not just one, all of the options. And also the last question is, how likely are those benefits and harms going to happen, or how likely are they to occur to me? And also always remember that doing nothing is also always an option. So these questions will help you be more involved in your healthcare.
And when it comes to, because sometimes patients can, experience, because healthcare is a very fast-paced environment.
Oh, it
and
is.
sometimes also the clinicians themselves, they rush you through the
Yep.
appointment, right? Like, or, they rush their patients with their, even maybe unintentionally, but
Yeah.
it's just because they're used to this pace, and then their patient, they realize that they're being rushed, and so they don't really have time to speak for themselves, right? What do you suggest that they do in this
that
case?
So ask those questions, and
Yeah.
if the healthcare professional doesn't have the answer, or is kind of, because that will help you and help the healthcare professional to pause during the encounter.
Yeah.
If they don't have the answer to you, ask them for resources. Ask them to direct you, and say that you want to look at your, you need to advocate for yourself. You'll need to put your foot down and advocate for yourself.
Yeah.
I know it's not easy to do because of a lot of patients, and a lot of people feel that they don't have the right to ask questions,
Yeah.
or to press pause and say, whoa, like, I need more time, or I need to understand this. But it is the right thing to do, and it's their right as well. So you'll need to advocate for yourself.
Yeah. And I feel like most of the time, a lot of patients kind of, because they think they don't have much knowledge,
Yeah.
right? They don't think that they have the right to ask,
Yeah.
right? And they just trust whatever the doctor says.
Exactly.
So, yeah, and I also agree with you. I feel like it's also still important to still ask, and still be curious.
Yeah.
And about your own health and your own body.
Exactly. And to be able to, it has been shown that to be able for patients, and I say patients, I mean patients, clients, persons, like I've used patients, but it's, all of the above, depending on the settings. And but it has been shown that for patients to be able, or to feel like they can be involved, they need knowledge.
Yeah.
And they also need power. Power being invited to make the decision. So as a healthcare professional, I think we all need to think about those 2 key points of, we need to exchange information, tell them that we value their input, and also invite patients, like explicitly invite them to be part of the decision.
Yeah, I think it's important. Okay, so Dr. Pacheco-Brousseau, thank you so much for taking the time to share your experiences and insights with us today. It was truly interesting to hear about the important role physiotherapy and rehabilitation science plays in improving patient care, and how impactful the research on this topic can be on patients' lives. For students listening, we hope this conversation provided a glimpse into how rehabilitation science and physiotherapy go beyond the clinic, influencing research, healthcare systems, and the ways patients are empowered to take part in their own care. Thank you, everyone, for tuning in to the Career Catalyst. If you enjoyed today's conversation, don't forget to follow us on our socials, which you'll find in the description, for more stories and events featuring different professions in healthcare and medicine. Until next time, keep learning and growing. Stay curious and inspired, and let each story bring you closer to finding your own place in healthcare. Thank you very much.
Thank you.